In just a couple of minutes. All attendees have been placed on mute for the duration of this presentation. If you have any questions at any time, please feel free to submit them via the Q&A box at the bottom of your screen. Again, if you are just joining us, we will begin momentarily. Good evening, everyone, and welcome. My name is Karen Moran, and I'm the Director of Alumni Engagement for Rutgers Biomedical and Health Sciences. I thank you all for being with us today and hope that you and your loved ones are healthy and safe. During this time of social distancing, the Rutgers University Alumni Association is expanding its offering of virtual programs to highlight the important work being done at the university and to help keep alumni connected. Tonight, we are honored to have with us Dr. Elissa Kozlov, a geriatric psychologist and instructor at the Rutgers School of Public Health, to discuss the mental health of our aging population during the COVID-19 pandemic. Elissa will be interviewed by her father, Herbert Kozlov, Rutgers College, class of 1974. It is now my pleasure to introduce Elissa and Herb.
Hi there. Thank you so much for having us. Dad, thank you for joining us tonight. Dad, are you there? You got to unmute yourself, Pops.
I did. Can you hear me okay?
Perfect. Now we can hear you, Dad. How you doing?
I didn't have the control panel. I'm doing
That's okay.
I'm doing great.
Great. Well, it's nice to see you over the distance.
Indeed.
All right, Dad, fire away. Ask me whatever you want in front of your peers and your fellow Rutgers alumni.
Well, thank you for asking me to do this, but I'm going to actually ask that question first. You're well trained and you're a professional in the fields of mental health, particularly aging. I've got no credentials and just a layman's experience. You know hundreds of professionals in your field. Why did you ask me to be the interviewer? Of all people, why me?
Yeah, that's a great question, Dad. And one that I hopefully don't end up regretting. So behave, okay?
That'll be a first.
Yeah, exactly. So when Rutgers asked me to participate in this alumni interview, I thought what an amazing opportunity to connect more with Rutgers. I've only been an instructor at the school for just about exactly 1 year. So I'm pretty new to Rutgers, but my connection is pretty deep because you and Mom both went there. Mom was Douglas. You're Rutgers 74, is that right?
Both of us.
So you're kind of my connection to Rutgers, and it just felt somehow fitting. And it's a pretty heavy topic, and I thought maybe you would add some levity and make this more of an edutainment type experience for everyone.
That's a lot of pressure.
It's a lot of pressure, I know. But essentially, Rutgers, our history and our connection to Rutgers goes deep, and I love the full circle connection. So I thought it would be fun to have you on. And, we're talking about older adults, and definitionally, you are an older adult, so you add to the lived experience of this.
Well, I'm going to stop you there. Define what an old adult is. I don't feel old. I hope I don't act old, and I don't think of myself as an old person. So what does one have to do to fall into your jurisdiction?
Yeah, I thank you for bringing that up. It's a pretty important point. So I think that age is it can be pretty subjective, but technically, according to the literature, we tend to put people in the age range of 65 and up as older adults. But that's kind of silly because a 65-year-old is not operating the same way physically, mentally, cognitively, emotionally as a 95-year-old. So I don't love that there's a giant bucket of 65 and up, because I don't think 65-year-olds should be treated the same way in research and medicine, et cetera, as say a 95-year-old. So I like to think about age more holistically. There's the chronological age, which technically, as a 65-pluser, you fit the category. But, you know, we'd have to take...
I plead guilty.
Yeah, you plead guilty. But we have to take into consideration chronic health conditions, environmental factors, things like that. So 65 is not 65, it's not 65. I get that. So you're okay. But technically, you would qualify for my research studies.
Okay. I accept that reluctantly, but I accept it. So next question for you. Growing up, for anyone who's listening, I'm a practicing lawyer, and I have been right out of Rutgers, right to law school, and I've been practicing law in New York City ever since that day. And growing up, you had all the skills to be a talented lawyer. I never won a debate or an argument with you. You had great verbal and other skills. You negotiated better than everyone. Anyone I knew. I thought you might become a lawyer. What happened? How did you end up here?
Oh, I wanted to use my powers for good, not evil, Dad. No, that's kind and sweet and totally biased of you to say. I think, you know, I knew for a long time that I wanted to study psychology and help people. I dabbled with theater for a little while in college. I was a theater and psych double major. But when it came time to devote myself to something indefinitely, from a young age, and you know, certainly throughout college and graduate school, the only thing that I could kind of wrap my head around thinking about forever is how our society can better the lives of older adults. And maybe it had something to do with watching my own grandfather age pretty poorly and slowly and uncomfortably. But I've always thought that we could be doing better by older adults. And, you know, aging is not considered a pathology, right? It's not, having a birthday every year is normal. It's expected. It's what we hope for. We want to grow old. And yet, I think a lot of people treat aging as pathology. I heard you tell me, shoot me before I get old. And yet here you are. So I just knew that this was something that I could never get bored of thinking about, and that would certainly not get solved in my lifetime. Not that there's a problem to fix, but just we could enhance the way that our older adults are cared for in our country, in the world, etc.
Okay, so you've studied this area for a long time at top institutions. You've been well trained. You've been practicing now in your field. You're an expert on end-of-life issues, palliative care, aging, and even dying. We have an audience here. What do you think it's important for people to know, both through their own experience, for those around them, their family? You've said it, aging is inevitable. So anyone who might be watching this, listening to this tonight, is going to experience or is experiencing right now the issues that surround aging and dying and palliative care. What do people need to know? What can we take away from tonight?
Yeah. Well, first, let me stop and explain what palliative care is, because I think that there's a lot of misunderstanding about what palliative care is. Palliative care is interdisciplinary, holistic care for people with life-limiting or serious illness, often provided by a team, such as a doctor, a psychologist, a social worker. Chaplain is usually involved, and it can be inpatient or outpatient. And most importantly, I think a lot of times people think palliative care and hospice care are the same thing, but palliative care can be considered the umbrella, and hospice care is one type of palliative care. So hospice care is specifically for people who are in the last 6 months of life, so have a 6-month or less prognosis. And you have to forego curative treatments when you're on hospice care. Palliative care, on the other hand, is for anyone at any stage of a serious illness. So you could still be trying to treat the illness and be a candidate for palliative care, because the goal of palliative care is to help you manage the symptoms and side effects of serious illness and its treatment. So I think it's important for starters that people know about palliative care and know that it's available to you or your loved one if you are facing a serious illness. So that's where my research is. I look at mental health for people with serious illness and mental health more generally for older adults and caregivers of older adults and those with serious illness. I also look to increase awareness and uptake of palliative care, because often it's onboarded way too late in the illness trajectory for it to be relevant, helpful, etc. So I guess there's a couple of takeaways that I would hope people have. One, that you now all know what palliative care is and that it is not hospice care. Two, is why palliative care is really important. So a lot of times palliative care can help people talk about things that are really uncomfortable to talk about, like, what do you want for the end of your life? What kinds of things are important to you in terms of quality versus quantity of life? Do you want to be resuscitated or intubated? Things like that. And that can really happen, either in the context of a serious illness or not. When my husband proposed to me, I recognized that he was about to become my default medical proxy, because the way it works, if you haven't listed anybody as your medical decision maker in the event that you are unable to make decisions yourself, the order goes spouse, parents, children, I think, and then siblings, I think, in that order. Kind of depends on what state you're in. But essentially, spouse trumps all. And so how old was I? 29. And my now husband proposed to me, and I said, great, let's talk about what I want for the end of my life, or what should happen, what I want you to decide for me in the event that I become unable to make medical decisions for myself. It was a truly romantic moment.
Well, at least you were planning to spend the rest of your life with him.
Well, I take the until death do us part moderately seriously. So, I think that this conversation, while by no means anyone's favorite topic, is a really important thing to have with the people in your life before it's dire, because no one really makes their best decisions in a crisis. And just because you have it now, I'm in my 30s, I have young children. My medical decisions will change throughout my life course, and I fully expect to have this conversation multiple times, but my hope is that perhaps people can start to have these conversations before it's too late to have them, because we never really know when that moment might be.
So your research is, and when you treat your clients and patients, it's not, you're not only speaking to aged people, but really helping the entire family as a family unit cope with all of this holistically.
That's absolutely correct, because the interesting thing about working with older adults and adults with serious illness is that you don't have to be one of those to know one of those people and to be intimately involved with them, right? Not everyone, hopefully most people have a parent or a grandparent who might fall into that category at some point. So becoming skilled at these conversations and thinking about these kind of hard to think about topics is relevant for you no matter what age you're at. So it's not that I go around, I have younger patients in my private practice. I'm not, if they come to me for anxiety over what job they should take next, I'm not going to be like, hey, you should really talk to your parents about death and dying. That's not how I roll. But when it becomes relevant in my work with patients with serious illness or aging parents, I help them figure out how to start the conversation.
Right. So you can't talk about anything today, whether you're talking about sports or theater or work or the economy, without the word COVID and pandemic coming up. What is the immediate impact and effect that you're seeing in your practice area and in your research for what's happening today?
Yeah, this is something that I've been writing a lot about for in a sort of non-academic light because this is a public health crisis, not just the COVID-19 pandemic, but the subsequent mental health fallout that I think we're going to see if we're not already seeing it. Social isolation is not a great recipe for mental health, and while social distancing is absolutely necessary to combat the pandemic, we psychologists have very large concerns about what the mental health fallout will be as a result. There's been lots of studies that show that isolation can be as detrimental to physical health through mechanisms like depression and lack of cognitive stimulation, things like that, as some of the physical health problems that we have. So, I think that a lot of younger people and certainly our audience tonight can find ways to use technology to combat some of the loneliness. I know that we Zoom call with friends, Dad, you and I have been FaceTiming a lot. What I really worry about with older adults is what about those who are not technology savvy, or what about those who don't have sharp enough hearing or vision to benefit from the technological advances that we have that kind of take the edge off of the social distancing. I really worry about people who are going to die from this without their loved ones surrounding them, and then those who are bereaved not being able to grieve in a community. Most religions, most cultures have grieving practices that call for the community to surround the bereaved and offer them social and emotional support, and that can't happen right now, and I really worry about the consequences of that.
So should people, at this moment or at other moments, people should be, it's really depressing to think about, but it sounds like we should be talking about, even if we're healthy, because you don't know what's going to happen, especially even though I disagree, you throw me into that old man bucket. Or should we be making death plans and planning our end of life, even if it doesn't feel imminent?
Before a pandemic, I would tell people it's not a bad idea to think about this and plan it because it's a gift to your family. I used to work in hospice care as a clinician, and the families who kind of were coping the best with the situation were the ones who didn't have to make decisions in an information vacuum. So, what we're seeing with COVID and what I've seen in hospitals a lot is that once a patient is intubated or ventilated or unconscious, they can't really communicate. And so then the family members are left to have to make medical decisions for them. And if you haven't had those conversations, then there's this terrible anxiety and responsibility that the family member who has to make decisions has. Is this what they would want? Is this the right thing? Am I honoring their life by making this decision? So even before COVID-19 hit, I would encourage families to have these types of conversations because you're right, you never know. I think that in light of the COVID-19 pandemic, death is sort of on the news a lot, certainly. Like we're getting the word death toll is used so often that it's hard to remember that those aren't just numbers, those are people's experiences. So part of me is wondering if this is a good time to have these conversations because it's way more salient in the public eye right now that safety is threatened. And it's a gift for your family to know exactly what you want, for you to have it written down so that, God forbid, something happens to you, they're not left wondering if they made the right decision.
It makes a lot of sense. Next question for you, Elissa. You know that Mom and I are doing our very best to stay active. Fortunately, I've still got a lot of work that I can do from our home office. We're taking our walks. We're having lots of Zoom interactions, video interactions with our friends. We have Zoom cocktail hours. We have non-Zoom cocktail hours. We have extra Zoom
All
cocktail.
right, ease up on the cocktail hours.
We're video chatting. We're seeing our children, our grandchildren as much as we can, our friends, but it's not real human interaction. It's not the same as giving someone a hug and a kiss. It creates anxiety. What more can we, not just your mother and your father, but what more can we as a group, people going through this, what more can we be doing to ward off kind of the depression and the anxiety that you deal with every day?
Yeah, it's an important, well, first of all, kudos to you for staying as active as you are. But, I think I could probably add in some of the sort of evidence-based strategies for fighting off symptoms of anxiety and depression. So one of the short and easy catchphrases I use a lot is do more, feel better. The more opportunity you have for enjoyment, the more likely you are to enjoy yourself, right? So most people don't have the best mood if they sit on the couch all day, every day for 10 hours, binge watching TV. That's not really a recipe for a good mental health experience. So do stuff, get up and move, find a hobby. One of the things I think is important is that you don't have to do things that are just enjoyable or pleasurable. You can do things that will give you a sense of mastery or accomplishment or achievement as well. So, for example, I don't enjoy cleaning my bathrooms, right? Like that's not a fun activity for me. However, after I clean the bathroom, I feel like I've done something important, I've achieved a goal, and that gives me a pretty similar mood boost as if I had done something that was objectively fun. The other thing I would say is it's a pretty important time to work on your sleep hygiene. So the best of us can suffer from difficulty with coping and anxiety when we're sleep deprived. So now is really a good time to set some pretty strict rules about sleep. Just because you don't have to wake up and go to the office in the morning doesn't mean you shouldn't wake up at the same time every day, try to go to bed at the same time every night, limit your naps. There's this basic idea with sleep hygiene that kind of blows people's minds if they never thought about it, which is that you have to be awake for 16 hours in order to expect to sleep for 8. So, it's kind of makes sense, right? 24-hour circadian rhythm thing. But a lot of people will go to bed at midnight and wake up at 8 a.m. and then think that they could go to bed at 10 p.m. the next night. And that's not going to work. You're not going to be tired. You've only been awake for 14 hours if you wake up at 8 a.m. and try to go to bed at 10 p.m. That's not going to work. So really practicing good sleep hygiene is important right now too.
So you've just given us one tip about sleep hygiene. It's not as simple as that, and maybe this isn't the forum, but you and your colleagues have a lot of expertise in spending time with people and going through a regimen and training people to sleep better. Is that accurate?
Yeah, that's totally true. There's a lot that we can do as behavioral health providers to help people have better sleep. So if you're struggling with sleep and you're doing what the sleep hygiene websites tell you to do and you're still struggling, reach out. Now, honestly, now's kind of a great time to try psychotherapy because it's never been easier to access a therapist. We are in your home with you. We're all doing video chat therapy. So if there's stuff that's going on that doesn't feel right to you, reach out and get some help. It's a good time for that.
Great. Next question. So we've touched quickly on depression, anxiety, staying active, even sleep deprivation issues. What are, at this moment in time, what are the other significant mental health issues, symptoms, syndromes that you as professionals are seeing a spike in or more concerned about because of the current state of affairs?
Yeah, so we're very worried about loneliness, especially in the nursing home settings. Nursing homes are on pretty strict lockdown, which they need to be, but as we described, it's a recipe for poor mental health. Some other things that you started to touch on, Dad, was substance abuse. People who struggle with substance abuse, it's not to be taken lightly. And I think if you are stuck at home and you have had problems with this in the past and there's substances available, there's not a lot of other behaviors necessarily as easily available as it used to be. You know, a lot of people are part of Alcoholics Anonymous communities and other things like that, and that support system is not as readily available. So we've been worried about substance abuse. Eating disorders have been something that we're really concerned about too. You know, hoarding food or having food in the house can be quite triggering for a lot of people who struggle with eating disorders. We're also worried about domestic violence. If you are sheltering in place or social distancing in your home unit with someone who is not safe to be with, that's of concern too, because there are fewer resources available to get help right now. And in general, anyone who has underlying issues that can, you know, underlying mental health concerns such as anxiety or depression, those tend to be exacerbated by periods of stress. And our entire world is experiencing some pretty intense stress right now, from unemployment to childcare concerns to concerns about getting sick or their loved ones getting sick. There's a lot of uncertainty and a lot of stress right now. And I think that, you know, even if you didn't have prior mental health concerns, I'm not surprised if people are struggling.
Terrific. So here's the last question I have for you. We've talked about your areas of expertise. I know that you spend a great deal of your time and energy doing research, and a lot of your research, or all of your research probably, is data-driven, not touchy-feely, and this might be right, but you've explained that to me. What research are you looking at now? And maybe tell us a little bit, because you've educated me a little bit, but I'm not sure that generally the population at large understands the extent to which the therapies, the treatments, and what you do is science and data-based. So the broad question is, what are you researching? What are you working on now? And explain the connection to results and data.
Sure. So one of my main studies right now is looking at how we can get caregivers of older adults who have dementia or cognitive impairment better access to mental health care, understanding that they have so many competing demands working. You know, some of them have full-time jobs, some of them are full-time caregivers, there's lots of doctor's appointments, et cetera. So prior to COVID-19, this research was looking at giving dementia caregivers a mindfulness-based therapy mobile application and training them in person on how to use this app. So mindfulness-based therapy is a mindfulness meditation approach to therapy. The app that I work with is called Mindfulness Coach. It's free and available on both the Apple and the Android platforms. And it's a really wonderful app that helps people learn how to focus on the here and now and be in the present moment. The app was developed by a team of psychologists at the Veterans Affairs Center. So this app was getting really good traction in my study. I think I had about 20 people recruited before COVID-19 hit. We were recruiting in geriatric outpatient primary care clinics. The nice part about the study is that because it's a mobile app-based therapy, we've been able to switch it to an entirely virtual study. So now we're recruiting in senior centers and virtual support groups and things like that, and continuing the work. And the work is really looking at, is this a feasible way to get caregivers more mental health care while operating under the assumption that they can't really come in and talk one-on-one for an hour a week with a mental health practitioner? And so we're looking at things like, do they use it? How much do they use it? Do they like it? How much do they like it? And we're also collecting things like, is their anxiety decreasing? Is their depression decreasing? Things like that. So when we talk about data-driven, what I mean is it's not me saying, hey, there's an app I like, right? I want to be able to say, hey, there's an app. 75% of users reduce their anxiety symptoms by 65% after using it for 8 weeks. for 20 minutes a day, right? I want to be able to tell you a prescribed dose of this treatment and have confidence that it is effective for a certain amount of people. We're not there yet on the app, but that is the goal, is to find out how and when and why to use the app.
I've got two last questions for you. One is, you just threw out some hypothetical numbers. 75% have this 65% improvement in symptoms.
Yeah.
Those, when you reach those conclusions, those are hard science statistical analyses. Is that right?
Yeah. Yeah. I mean, eventually, yes. Right now, it's all pilot, so we don't. I'm not going to bore you with the statistics of why that's not quite there at this point, but yes, the goal for behavioral researchers such as myself is to say things like that with the confidence that, you know, large studies can give us.
Terrific. And then my second question is, would you repeat 2 times slowly the name of that app for anyone who's listening?
Yeah, I will. I think I can get the alumni groups to send it out too, and to send out. I think people can sign up for my study too. So it's called Mindfulness Coach. That's it, just Mindfulness Coach. And Dad, I'm going to pause you because I see that we've been getting some questions in the Q&A. So I want to try to make this a little interactive. And if folks have more questions, please put them in the Q&A box. Let's see. Is there a psychometric instrument to understand the impact of COVID-19 on mental health? Oh, wow, what a great question. I'm not sure. I've been seeing some research out of China that's trying to understand the impact of COVID-19 on mental health, because they're a few months ahead of us. My guess is that they're using the psychometric instruments for anxiety, depression, stress, etc. You know, we have a lot of good instruments for general mental health concerns that I don't know if they would have to be COVID-19 specific, but right now, most of that research is coming out of China, a little bit from Italy as well. So it wouldn't surprise me if there's some decent data on that coming out soon, but I'm not sure if there's a COVID-19 specific scale. Let's see, have we seen an uptick in deaths from mental health consequences since the pandemic? Is there any research being done that defines the elderly as a specifically susceptible population to depressive symptoms at this time? That is a great question, and one that I know has been a little bit in the news lately too. We have concerns that there will be an uptick in what we call deaths of despair. So those are deaths by suicide or by overdose or other mental health related things. I am not aware of us having that data yet. So I don't know the answer to that one, but I will be keeping an eye out for it for sure. And the research, there is research currently being done looking at older adults and mental health symptoms, specifically depressive symptoms. But the past literature on older adults is why we're particularly concerned about this population. So we know that older adults in isolation are at high risk of depressive symptoms, and that is essentially what is happening right now in a lot of the nursing homes and assisted living facilities. What would be your suggestion for youth who are not living at home and not seeing their families due to COVID? For example, placements, foster care services. That's a great question. I'm not sure that I have that. They don't let me talk to kids other than my own. I'm a geriatric psychologist primarily, so I actually have very little experience doing any mental health work with little kids or really anyone under the age of 18. So unfortunately, I don't think I'm the right person to answer that. But I do believe that there's another alumni event with a psychologist from the Graduate School of Applied Psychology who might be better equipped to answer that question. In what ways can we disseminate this information to the population who are less tech savvy in the age of social distancing? Thank you, Brenna, for that question. Yeah, this is one of my main concerns is how are we getting older adults who are not tech savvy resources? So I've been working with a couple of senior centers right now, and they're doing this incredible job of doing wellness phone calls pretty regularly, wellness check-in phone calls. And so my hope is that as part of that program and maybe other programs that are popping up, older adults can get more information. The nursing homes, some of them have been doing a pretty good job of facilitating FaceTime and other video chat experiences for their residents with their loved ones at home. But I don't think anything is being done uniformly across the board because, you know, these things occur and differ from institution to institution. There is a kind of like a standard that's being applied. Something I've been telling families to do, if your loved one is not tech savvy and you're far from them, think about low tech strategies. Send them printed out photos in the mail or care packages or letters where you write things in large format with Sharpie marker on index cards. That's my favorite way for vision impaired older adults to get the information. You know, even just calling them and letting them hear your voice. These are important things to do for older adults who might not have the tech skills to engage in things like this. Here's a question of a very specific experience that I'm going to table for now because it's a very specific case, and I want to make sure I'm helpful to the larger group. The approach to mental health in elders in the era of COVID-19 depends on the cultural factors as well, at least to some extent. That is true. Yeah, different cultures definitely have a different approach to mental health care in general and to aging care in general too. So thank you for bringing up the cultural differences. Let's see. I notice you mentioned about age specifically with people 65 and up. Mental health also affects younger people who have to care for palliative family. What kind of advice do you give for coping with this mental issue? So I think the question is asking if you are currently caring for someone who is coping with a serious illness, what advice do I have for people who are in the caregiver role, especially given the distance? Something I think is important to think about for all caregivers is what the flight attendants always say on the airline, right? They say in the event of turbulence, should the air masks deploy, put your mask on first before assisting others. And as a little kid, I used to think, well, that's garbage. Mom and Dad, you better put my mask on first because I'm the most important. Very egocentric view over here. But I actually think, you know, this is an important line to share with caregivers because the reason why you have to put your mask on first before assisting others is you're no good if you are unconscious, right? Once your mask is on and you're taking care of yourself, you can better take care of those around you. And so with caregiving, especially from a distance, it sounds counterintuitive, but what can you do for yourself? Because you can't burn out, right? If you burn out, you're not helping those around you. And with this distance right now, one of the things that you have to keep telling yourself over and over again is that you're doing the right thing by staying socially distant. I know that there can be guilt and there can be concern, and certainly if there's a situation where you need to break the social distancing, then by all means. But thinking about how you can be kind and gentle and compassionate to yourself while dealing with all this stress is a really important lens to take. It's a challenge for sure. Oh, I just found more questions. From what I've seen, do my patients with dementia understand what's going on? Going on with the pandemic? Thank you. I actually can't answer that right now because I'm not seeing any patients with dementia. I I am a provider in New York City, and up until the last couple of weeks, Medicare wasn't allowing for video visits. So when I moved to New Jersey for the Rutgers job, I had to stop seeing my Medicare patients. So I actually don't have a ton of older adult patients myself right now. So while that's my research area, it's not my clinical area currently. So I don't have any dementia patients right now. So I don't know, but my guess is that there's days where maybe they understand and days where they don't. You know, dementia patients are not all the same. So different older adults with dementia have different levels of cognitive functioning and certainly deteriorates as the illness progresses. But I would be really curious to know a little bit more about what's happening in the nursing homes. I know that the conditions are sort of ripe right now in nursing homes for worsening cognitive functioning. You know, even I have my husband's grandmother is sharp as a tack, but she's currently in isolation in her assisted living facility, and I'm noticing some things, which makes sense because her robust social life is now down to just phone calls from time to time. And a lot of brain functions are kind of use it or lose it. That's why people always want you to do crosswords and different kinds of mental acuity things. And so if you're not engaging with the different components of your brain through socializing, through attending lectures, things like that, you know, you might start to see some cognition points go down, especially in older adults who are already at risk of that. Dad, did you have any questions? I've just been...
No, I'm just sitting here in awe.
Typical dad response.
Thank you both so much. This has been so much fun. Elissa, is there anything else you'd like to leave the audience with before we go?
Oh gosh, that's so much pressure.
Sorry.
No, it's great. I'm just so appreciative to everyone for tuning in. I hope that I gave you the information you were looking for, and hopefully, you know, it's a heavy topic. It's a heavy topic, and I hope that this was helpful to folks and maybe mildly entertaining at the same time.
Well, it really was. As someone who is a caregiver for a family member with dementia, I really appreciate all the information that you were able to share with us tonight. I would imagine that many people on this call are in a similar situation. So thank you so much. But
yeah,
officially,
well, thank you.
Yeah, go ahead.
No, just thank you for having me. And I hope if there's one, I think the one take home is talk about the hard stuff early and often. That's it.
No, it's good. It's good. I know I'm gonna go talk to my husband now.
I know. It's the most romantic conversation you can ever have. Trust me. It was beautiful for us.
Oh goodness. I thought I turned my camera back on. Just talking to me is just a voice, but well, if that's all we have for this evening, I'd really like to thank both of you for hosting this webinar for our alumni and friends. I hope you all enjoyed the presentation. You'll be receiving a follow-up email from us shortly, which will have a short video, a short survey to provide any feedback. Thank you again, and I hope you'll join us for another upcoming webinar. Stay healthy and safe, and everyone have a great night.
Thank you, everyone. Take care.
Thank you. Bye.